Hi, I'm Joseph Kugler. I'm one of the collaborative care psychiatrists here at Televero Health. We want you to feel like when you're referring with a confidence level, that your patients are seen in a timely fashion, that you have credible and usable recommendations for your patients. We want to make sure that they get excellent care with us. I want to take a few minutes to pass on some wisdom we've learned over the years in practicing psychiatry at the interface with medicine and other specialties. You've been treating somebody for a long time, but you've reached the limits of that, and you'd like to refer them to somebody with more expertise or specialty training in there. And it turns out that when you can communicate to patients that you actually know somebody who can help them overcome the barriers that you all have run up against in treatment, and that you actually happen to know some folks who are very accessible who can help them with that and help guide them with the right treatment, be it with us or in consultation with you, we're going to have a much better time in getting you all the help you need. For the patient who has belief systems, be they cultural or health literacy or otherwise, who is reluctant to receive a referral or activate a referral for behavioral health, it turns out how you phrase the referral, how you communicate it, it's really where battles are won or lost, with whether or not a patient's going to take that advice and come and see us or see any behavioral health specialist. We're going to take an example, Mr. Jones. So Mr. Jones has COPD. Okay, he comes in, he talks about sleep difficulties all the time. He talks about nervous tension. He describes panic attacks or panic-like symptoms with his breathlessness. And you all are wise and you recognize that this is generalized anxiety or this is a panic disorder or this is PTSD if this patient's been hospitalized multiple times with COPD exacerbations. So they're going to be very focused on COPD. You know it has a huge behavioral component and stress component, reactivity component. When you start talking to the patient about those conditions, a lot of times the communication breaks down. We lose patients here sometimes if they're not psychologically minded, if they don't interpret their clinical condition as something that's behavioral or psychiatric in nature. There's a few things that we can do in the language of how we refer patients that can really help here. When we start labeling their experiences free of jargon, like sadness, worry, fear, afraid, um, anger, rage. Those are all emotions that many people can associate more readily to. Sometimes you can say something like stress has actual physiologic effects on COPD and people's experience of breathlessness. We know some experts in stress management, and then within the first 5 or 10 minutes, we're going to normalize things. We're going to make them feel comfortable and begin to unravel what's been going on and try and get you guys some help.